Developmental delays and the effects of premature births. Baby T and KJ were one of the many reasons I wanted to do this project on premature births and developmental delays. Baby T and KJ are twins. They were born at 33 weeks and 3 days. They were 4 pounds, 3 ounces, 17.25 inches long. A premature baby is one who is born too early. They are born before 37 completed weeks of pregnancy. Premature babies can have many health problems. They need to stay in the hospital longer than babies born on time. According to the March of Dimes, nearly 500,000 premature babies are born in the United States each year. Most premature babies have to spend time in the neonatal intensive care unit. The NICU is the part of the hospital that takes care of sick newborns longer. A preemie baby can have many health problems. Some of the health problems that they can have are breathing problems, heart problems, brain problems, and temperature control problems. Breathing problems. A premature baby may have trouble breathing because they have an immature respiratory system. Sometimes breathing difficulties can prevent other immature organs in the body from receiving enough oxygen. Premature babies lack a protein called surfactant, which helps the baby's lungs to expand. This is called respiratory distress syndrome. RDS typically affects infants born before 34 weeks. Preemies born between 23 weeks and 32 weeks may also develop chronic lung disease known as bronchopulmonary dysplasia. Some preemies experience prolonged pauses in their breathing known as apnea. Heart problems. The most common heart problem premature babies experience is called PDA and also hypotension. PDA, which tends to affect babies born before 30 weeks, is a persistent opening between two major blood vessels leading from the heart. While this heart defect often closes on its own, left untreated, it may cause too much blood to flow through the heart and cause heart failure, as well as other complications. Low blood pressure may require adjustments in intravenous fluids, medicines, and sometimes blood transfusions. Brain problems. Babies born before 28 weeks are at risk of bleeding in the brain, known as intraventricular hemorrhage. Most hemorrhages are mild and resolve with little short-term impact, but some babies may have a larger bleeding in the brain, which causes permanent brain damage. Larger brain bleeds may lead to fluid accumulation in the brain, also known as hydrocephalus. Over a number of weeks, some babies who develop hydrocephalus will require an operation to relieve fluid accumulation. Another problem preemies can have is temperature control problems. Preemies can lose body heat very rapidly. They do not have stored body fat of a full-term infant. Preemies must be kept in an incubator or under a warmer. They cannot generate enough heat to counteract that is lost from the surface of their bodies. When the temperature dips too low, that can cause hypothermia. Hypothermia in a preemie can lead to breathing problems and low blood sugar levels. Don't worry, when you bring your baby home, you should not need to keep your house or apartment warmer than you typically would. Another health problem that preemies can have is gastrointestinal problems. Preemies are likely to have immature gastrointestinal systems. The earlier a baby is born, the greater risk he or she is at developing NEC. This potentially serious condition, in which the cell lining of the bowel wall is injured, primarily occurs in premature babies after they start feeding. Premature babies who receive only breast milk have a much lower risk of developing NEC. Preemies sometimes have blood problems. Blood problems in preemies can cause anemia or infant jaundice. Anemia is a common condition in which the body does not produce enough red blood cells. While all newborns experience a slow drop in red blood cells in the first month of life, the decrease is greater in preemies. If a preemie has a lot of blood taken for lab work, they might be at a greater risk of developing anemia. Infant jaundice is the yellowing of the newborn skin and eyes that occurs because the baby's blood contains an excess of yellow-colored pigment of red blood cells. It is common in preemies born before 38 weeks. Another problem preemies can have when they are born is metabolism problems. Preemies often have a problem with their metabolism. Preemies may develop an abnormally low level of blood sugar, which is called hypoglycemia. This can happen because preemies have smaller stores of glucose than full-term babies. Preemies have an immature liver, so they have trouble producing glucose. Immune system problems can develop in a preemie because they have underdeveloped immune systems. Having an underdeveloped immune system can lead to a preemie to have an infection. Infection in a premature baby can spread quickly through the bloodstream and cause sepsis. Sepsis is a life-threatening complication. Your baby's doctor will monitor the infection and give antibiotics until the infection is gone. Preterm babies can suffer lifelong effects such as cerebral palsy, mental retardation, visual and hearing impairments, and poor health and growth. Babies born only a few weeks earlier often have long-term disabilities such as behavioral and social-emotional problems, learning difficulties, increased risk of conditions such as attention deficit hyperactivity disorder. Some studies have estimated that as many as 40 to 50% of children born prematurely will have some sort of learning disability. Premature babies have an increased risk of sudden infant death syndrome. Children born preterm are more likely to require early intervention and special education services. Children born about 3 months premature are 3 to 4 times more likely to struggle in school than children born full term. Compared with children born full term, students born prematurely were more likely to repeat a grade of school, receive special education, and require extra help with reading, spelling, math, handwriting, speech language, and occupational or physical therapy. Children born preterm are more likely as adults to have chronic diseases such as heart disease, hypertension, and diabetes. Thank you for listening to my presentation. If you would like more information on premature babies, please visit the March of Dimes website.